Ever woken up feeling like you've run a marathon even though you've had a full night's sleep? Imagine that sensation, but it lingers day after day. That's the reality for those with chronic fatigue syndrome, or CFS. But before we dive deep into this topic, if you're keen on uncovering health mysteries and getting insights on well-being, make sure to hit that subscribe button. And stay tuned because by the end of this video, we'll reveal a list of symptoms that might surprise you. Will you recognize them all? There's only one way to find out. Let's dive in. Now, CFS isn't just about being tired. It's a condition that's as complex as it is misunderstood. It's like having an energy-draining shadow following you around, making even the simplest tasks feel like climbing a mountain. But what exactly triggers CFS? This is a question that has puzzled researchers and doctors for years. While the exact cause remains elusive, several theories have emerged over time. Viral infections. Some people with CFS can trace the onset of their symptoms back to a viral infection. Viruses like Epstein-Barr, human herpes virus 6, and even certain strains of the flu have been investigated as potential culprits. It's as if the body's response to the virus goes into overdrive and doesn't quite know how to switch off, leading to prolonged fatigue. Immune system abnormalities. There's evidence to suggest that people with CFS might have a slightly malfunctioning immune system. It's not necessarily that the immune system is weak, but rather that it might be overactive in certain areas, leading to inflammation and, consequently, fatigue. Hormonal imbalances. Researchers have noticed that people with CFS sometimes have abnormalities in their hormone levels, particularly stress hormones and those produced in the hypothalamus, pituitary glands, or adrenal glands. These imbalances could contribute to fatigue and other CFS symptoms. Physical or emotional trauma. Some people report that their CFS symptoms began after a major physical injury, surgery, or significant emotional stress. It's as if the body and mind, already grappling with trauma, become more susceptible to CFS. Genetics. There's also a line of thought that suggests a genetic predisposition to CFS. It's possible that certain genetic markers or mutations make some individuals more prone to developing the condition. Environmental factors. Exposure to certain toxins, pollutants, or chemicals might also play a role in triggering CFS in some individuals. It's like the body's systems get overwhelmed by these external factors, leading to fatigue and other symptoms. It's worth noting that it's likely not just one of these factors that triggers CFS, but a combination of several. The symptoms of CFS are as varied as they are vexing, painting a complex picture that can sometimes be hard to decipher. It's not just about feeling perpetually drained. The range of symptoms can affect multiple systems in the body. Profound fatigue. This isn't your everyday tiredness. It's a deep-seated exhaustion that doesn't improve with rest and can be worsened by even minor physical or mental activity. It's like having an empty battery that just won't recharge. Post-exertional malaise. After any form of exertion, be it a short walk or a mental task, symptoms can flare up and intensify. It's as if the body is protesting against any form of energy expenditure. Sleep disturbances. Despite feeling exhausted, many with CFS struggle with sleep. They might face difficulties falling asleep, staying asleep, or waking up feeling just as tired as when they went to bed. Cognitive difficulties. Often referred to as brain fog, individuals might experience memory problems, difficulty concentrating, and challenges with processing information. It's like trying to think through a thick cloud. Muscle and joint pain. Without any obvious cause like inflammation or injury, many report persistent pain in their muscles and joints. Headaches. These aren't your typical headaches. They can be severe and different from any other type of headache previously experienced. Sore throat and tender lymph nodes. Some with CFS often complain of a recurrent sore throat and swollen lymph nodes, mimicking the symptoms of a prolonged cold or flu. Sensitivity to light and sound. Everyday stimuli like bright lights or loud noises can become overwhelming, leading to further exhaustion or discomfort. Dizziness and balance issues. Standing up can sometimes lead to dizziness, and some individuals might experience bouts of imbalance or vertigo. All these symptoms can come and go, with some days being better than others. It's a fluctuating landscape of discomfort, making CFS a particularly challenging condition to navigate. And here's where it gets even trickier: diagnosing CFS. Unlike conditions where a simple blood test or scan can give clear answers, CFS often lurks in the shadows, eluding straightforward detection. First off, there's no single diagnostic test for CFS. Instead, doctors often find themselves playing a game of medical elimination. They'll run a series of tests to rule out other conditions that have similar symptoms. Think of it like trying to find a needle in a haystack, but first you have to remove all the other needles that look almost identical. Moreover, the symptoms of CFS can vary widely from person to person. Two individuals with CFS might present entirely different sets of symptoms, making the diagnostic process even more challenging. It's like trying to solve a jigsaw puzzle where each piece can fit in multiple places. To further complicate matters, the symptoms of CFS can overlap with other conditions like fibromyalgia, sleep disorders, or even depression. This means that even if a patient ticks all the boxes for CFS, they might still be diagnosed with something else entirely. Because of these complexities, many with CFS often embark on a long and sometimes frustrating journey before receiving a definitive diagnosis. It requires patience, persistence, and a medical team willing to look beyond the obvious. So, how do you treat CFS? It's a question with no one-size-fits-all answer. Since CFS is a multifaceted condition, its treatment often requires a multi-pronged approach. Medication. While there's no specific drug for CFS, certain medications can help alleviate symptoms. Pain relievers might be prescribed for joint and muscle pain, and sleep aids can assist those struggling with insomnia. Therapy. Cognitive behavioral therapy has shown promise in helping patients cope with CFS. It's about changing the way one thinks about the condition and developing strategies to manage daily life. Lifestyle adjustments. Pacing oneself is crucial. This means balancing periods of activity with rest, ensuring not to overexert and trigger a flare-up. Diet and supplements. Some find relief by tweaking their diet or taking certain supplements, though it's essential to consult with a healthcare professional before making any significant changes. In essence, treating CFS is about personalization, understanding each individual's unique needs, and tailoring a plan that offers the best chance at symptom relief. Lifestyle changes can also play a pivotal role. This might mean redefining your daily routine, setting limits, and prioritizing self-care. It's about listening to your body and understanding its new rhythm. Many find solace in support groups, where they can share experiences and coping strategies with others who truly understand. In essence, CFS is more than just feeling tired. It's a multifaceted condition that demands understanding, compassion, and a holistic approach to care. For those living with CFS, every day can be a challenge, but with the right support and resources, they can navigate this journey. Remember, everyone's journey with CFS is unique. While we've shared general insights, it's essential to tailor any approach to your specific needs. And on that note, a quick but important reminder: always consult with a qualified healthcare professional regarding any medical condition or before making any changes to your healthcare regimen. With that said, thanks for watching, and until next time.